It's rare, but becoming increasingly of an issue that comes up as women are delaying childbirth until their 30s or 40s, and we see over 10% of breast cancers in women in that age group. We're starting to see that they coincide more often, about 1 in 3,000 pregnancies. It's more likely that the breast cancer is there, and we may see it kind of erupt quicker because of the hormones that occur with pregnancy. It can be common, and it is sometimes an option, especially when you detect breast cancer very early in pregnancy, but it hasn't been shown to improve breast cancer outcomes, and we can still treat breast cancer during pregnancy with our standard chemotherapies and surgery, as long as we can get the woman to the second trimester. I think that more awareness can be raised that breast cancer can be treated during pregnancy, and that a woman can focus on being a mom and still maintain her pregnancy. The trouble is that early in pregnancy you have a lot of breast changes that are occurring. So women feel different lumps and bumps changing in their breasts, and most of the time it is normal and they think it's normal. And sometimes even the physicians examining them think it's most likely normal breast changes. But if you feel a mass, or you see your nipple going inwards, or you see a rash on the breast, those are reasons to consider getting some imaging so we can rule out anything more worrisome. I get invested in all of my patients, but yes, when there's an additional patient on board, it becomes more complicated. When it comes to finding breast cancer during pregnancy, it can be overwhelming, and mom is usually in a very vulnerable state. But there are options, and the options are the standard of care treatment. We just have to orchestrate it a little bit differently to get her through the treatments. And it really takes a team. So you need a breast surgeon, a medical oncologist, radiologist, maternal fetal medicine specialist, and your OB to all coordinate and rally to get you through, but we have that for you. If women are delaying having children until later in life, we're probably going to see it more often.
I easily got pregnant with Reese. I would say we tried for a month or two, and with the second baby, we probably tried for about a month and then had a positive pregnancy test, so that was great. In that waiting period, I found a lump in my left breast and tried not to freak out about it, and just was like, I'm going to go in and we're going to get it checked out, and it's hopefully maybe just my breast changing with pregnancy. And then we got an ultrasound after I went into my OB, and then that led to a biopsy. This was all at the beginning of October, and by Thanksgiving, I knew I had the Tuesday after Thanksgiving, I knew I had breast cancer. I think everyone was in shock. I mean, everyone in this process, like the radiologist said, just to be safe, we should get a biopsy. I saw a surgeon before I had my biopsy, just to be safe, we should do this. You know, so I was almost even given the option to not do anything and just continue on. But I'm a nurse and I can't just have things wait. I was seen at a previous facility, and yes, termination was on the table, and that wasn't an option for me, and so I sought out a second opinion. Timeline of events, there's a reason I got pregnant. Like, you know, and I have religious beliefs, and there's a reason I got pregnant, and there's a reason we're in this together. I mean, I think it was in shock for, I probably am still kind of in shock of, you know, I have no history of breast cancer in my family, so like, I never thought that this was going to be something that I would go through in life, especially this young and being pregnant at the same time. You know, I feel like I've just kind of tried to take it head on and, you know, have a positive attitude about it. And I feel like having the focus of the pregnancy through all of this has probably helped me through this. I had a single mastectomy because we didn't want me under anesthesia for any longer to protect the pregnancy. I've had chemo while I was pregnant, and then we're gonna have baby, and then recover from delivery, and then have more chemo. Dr. Nye was at my OB's office and had a conversation with her the day that I went in, like the day after I found out I had breast cancer. And so, and in that process, I had already had a call into KU to get a second opinion. I'm so thankful that I can be home with my 3-year-old and get all my treatments and be here in Kansas City, and it's, I mean, words can't express. I feel good. I mean, I feel like a pregnant woman right now. I don't feel like, I mean, other than appearance-wise, you know, having no hair most of the time, but, you know, I feel like a pregnant person, which is good. It's nice to focus on that. I'm nervous. I don't think his head is down, and we're supposed to be having a baby in 3 weeks. I'm a NICU nurse, so I know way too much on that side of things. But, you know, I hope that this is all part of the bigger plan. So we'll just kind of go from there, take things one step at a time. So I think that's what I've gotten through all of this is, it's kind of, okay, we deal with this and we're going to get through that portion and then we're going to move on to the next portion, and meaning like the first rounds of chemo and then having a baby and then more chemo and then radiation. So I'm just thankful that I'm probably going to have 2 children here and just be able to live my life and be a mom. You know, that's what's great about all of this, is that I'm going to get to that point that I'm going to go back to just being a mom and not having to be a cancer patient too. I don't have cancer in my body right now. Okay. I mean, we removed it with the surgery and we're playing cleanup with chemo. Okay. And then we're going to even play a little bit more cleanup with radiation. Okay. So the hope is that it's all gone and we'll move forward. I breastfed my first child for 14 months. Is breastfeed with my left breast just for the first month. Hopefully I will make milk. The chemotherapy could have made it so that I don't produce milk. And then once I start chemo again, my milk can't be provided to the baby. So a short period of time, but that's better than nothing. You have to go with your gut. Like I knew that that wasn't an option for us. There was, you know, for my husband and I, that the timeline of events that, okay, well, there's other places. We could have traveled somewhere. It just happens that KU is here and we found Dr. Nye and the community here that allowed us to be treated and do what we wanted to do. I mean, you have to, you know, you're a mom, so listen to your gut. I think that's what's gotten me here in the first place. Like, I knew I was sick. I just hadn't pinpointed, you know, like I'd had a headache for most of 2016 and I didn't quite know why. And I tried, you know, I had an MRI of my head. Well, if we would have had an MRI of my whole body, we would probably find my breast cancer, you know, but then I wouldn't have gotten pregnant. So, I mean, it's just kind of like all things happen for a reason and you need to fight for yourself. I'm a Royals fan. My parents have had tickets since the 70s. I've been going to games my whole life because my parents have been fans. And so, yeah, it's a great honor. I mean, I feel like I didn't expect that this was going to be my platform, I guess you would say. But it's nice to, you know, have that and have other people aware. I wasn't that typical person that gets breast cancer. You know, I mean, if you look at everything that I've done in life, it's to not get breast cancer. It's not in my family. I breastfed my first kid. Like, you know, I didn't do monthly exams, but maybe if I did them, I could have found it earlier, but then I wouldn't have been pregnant. So, I mean, it's just kind of, you gotta know that anything can happen and you gotta protect yourself. You get caught up in the what ifs and that's when it's dark. You have dark days. And I think that my husband and I have just like kind of bonded together and gotten through this, and I couldn't get through this without him. He's been such a support and kind of taken on everything else so I can just do what I can do and be the mom that I am to kind of move forward. Just kind of learning what, you know, days 4 through 7. But
And your ultrasounds have been looking good of baby.
With kind of knowing what's going on, I'm not clenching my teeth as much, and I really feel like those two things. I have another ultrasound tomorrow.
Need our radiation oncologist as well.
Awesome.
You've had should be completely out of your system within a few days of actually receiving it.